Unlock your hips, unlock pain-free knees. If your knees hurt, your first instinct is probably to blame them. But in many cases, knee pain isn't about the knees at all, it's about what's happening above them. Tight hips, especially when combined with weakness or poor control, can alter how your legs move, forcing your knees to compensate in ways they're not designed to. Over time, this added stress leads to chronic discomfort and, in some cases, serious injury. Understanding the hip-knee connection is the first step toward relieving that pain and moving better. Why tight hips strain your knees? The hip is a ball and socket joint built for mobility in multiple directions. The knee, on the other hand, is a hinge joint that primarily moves forward and back. When your hips don't move as they should, whether due to stiffness, weakness, or a lack of pelvic control, your knees pick up the slack during activities such as walking, running, squatting, or climbing stairs. For example, when the muscles on the outside of your hips aren't keeping your hips aligned and providing lateral stability, your femur, thigh bone, can collapse inward, placing extra stress on the inside of your knee. When your pelvis isn't moving properly because it's restricted or imbalanced, it affects how your thigh bone aligns with your shin. That type of pelvic problem causes the kneecap to shift off-center as it moves, rubbing against the cartilage beneath it. The altered alignment resulting from these two issues causes significant stress and uneven wear and tear on the joint, contributing to conditions such as patellofemoral pain syndrome, pain around or under the kneecap, also known as runner's knee, and cartilage breakdown that can lead to osteoarthritis and other debilitating issues. The role of lifestyle and movement habits. If you spend most of your day sitting, your hip flexors are likely tight and your glutes may be underactive and weak. That imbalance can create a domino effect, leading to limited hip extension, poor pelvic alignment, and less stability throughout your lower body. Even athletes aren't immune. Repetitive motions such as running, cycling, or weightlifting without proper mobility work can reinforce asymmetries or restrictions in hip movement. And when your training lacks adequate attention to hip rotation, lateral movement, or glute strength, your knees are the ones that suffer. Please like and subscribe for more information.